Good day. Welcome to Learning Thursdays. Learning Thursdays are offered to addiction professionals as a free learning opportunity with the goal of improving the knowledge, skills, and attitudes of the New York State workforce as we strive to improve the lives of individuals in prevention, treatment, and recovery services. The presentation you are going to view is entitled New York Connects and will be presented by J. Paul Noonan from New York State OASAS and Mike Gunn from the New York State Office for the Aging. As always, folks, if you have any questions, suggestions, comments, feel free to send them to us via the learningthurs@oasas.ny.gov mailbox. That being said, at this point, I would like to turn it back over to Paul and Mike so that they can talk to you about New York Connects. Thank you, and see you at the end of the presentation.
Hi, everybody. This is Paul Noonan from OASAS, and welcome to another Learning Thursdays. As some of you may know, I have been serving as the OASAS Coordinator for Veteran Services now for several years. In addition, however, which you may not know, I am also our agency point person or information point for matters relating to seniors, older adults, aging populations, etc. This means, just as with veterans and military services, I am a resource, not necessarily an expert, but I am supposed to help answer any questions that you may have. If I don't have the answer, I will get back to you. But right now, let's focus on the presentation we're about to bring to you today. New York Connects. This is a fascinating and actually groundbreaking idea and program, in my opinion. I've only been involved in the area of older adults now for about 2 years. And it's that over those 2 years, I've come into contact with many other people from other state agencies, in particular folks from the New York State Office for the Aging, which is commonly referred to by the acronym NYSOFA. Throughout my career as a state employee, I've worked with other state agencies, but that's also oftentimes been precipitated by a funding agreement or a directive to work together. In other words, what I'm saying is, as we all know, there have been a lot of silos in state government over the years, and it's been hard to lower those silos and work together. New York Connects sort of eliminates that. New York Connects is not so much a program as it is a partnership. And this is my own personal take on this. I don't believe there are any regulations enforcing it. I don't believe there's any funding mechanism associated with it. It's a concept and a partnership, and I think therein lies the beauty of this. What could be better for any of the clients we serve than to have them have access to whatever services they may require for either themselves or their family in a seamless, efficient, and relatively quick manner. New York Connects is such a program. New York Connects is based on the theory of no wrong door, which we often abbreviate as NWD. And of course, no wrong door means literally there is no wrong door. However, New York Connects establishes that door through which a person may pass and find access to many services which they may need, including those of our own field. Last fall, I was part of a round of regional trainings which went on around the state to introduce people who work in the aging services to changes taking place in New York Connects, which has actually been around for several years. My role in these regional trainings was to give the attendees an idea or a picture of what happens in the OASAS system, how it's structured, how it's designed to function, and how they may best interact with it. So now it's your turn, you folks working for OASAS certified providers, it's your turn to learn about New York Connects. and we hope you will benefit from understanding and learning more about this program, which many of you may already know about. We really don't have any idea. Oftentimes in my career, I found out that when we go to a community with an idea, they're already doing it. So I hope you are, and if not, I hope you will after this. So without delaying any longer, I'd like to introduce our speaker, our true subject matter expert. It's Michael Gunn, who's an assistant director with the New York State Office for the Aging. I've gotten to know Mike over the past year, and it's been a pleasure to work with he and his colleagues at NYSOFA. And well, Mike's the expert, and I'll happily turn the microphone over to him.
Thank you, Paul, and thanks for having me here today to talk about New York Connects. As Paul mentioned, I'm an assistant director in the Division of Policy, Planning, Programs, and Outcomes at the New York State Office for the Aging, and it's an honor to be here to talk about the program today. So we're going to cover a couple learning objectives which set the framework for today's presentation, which will span over the next hour or so. One objective is to recognize the Balancing Incentive Program as the reform effort driving the implementation of the No Wrong Door system. And the second objective for today is to identify the intended goals of New York Connects and the services provided as they pertain to restructuring New York State's long-term services and support system. And we begin with an image or a picture that captures really the spirit of New York Connects. As Paul had mentioned in the introduction, that long-term services and supports and the Health and Human Service Network can often be siloed, and that individual providers and agencies tend to provide the services and supports for their particular constituents or participants. And so New York Connects is a way to break down the silos and bridge the gaps between individuals who need services and supports and the services and supports that they need. So use this picture to kind of exemplify that notion. And what is New York Connects? It's a formal partnership between government and community-based designated agencies to deliver comprehensive information and assistance on long-term services and supports. And New York Connect serves individuals of all ages, regardless of disability and regardless of payer source. So it serves individuals who are looking to access Medicaid services as well as private pay or other government-funded services. Long-term services and supports, we just want to define this because the rest of the presentation is going to focus on the provision of services and supports. And so when we're talking about long-term services and supports, we're talking about medical and non-medical supports for individuals with a chronic disease, disability, or who have a need for help with activities of daily living or instrumental activities of daily living. And these types of services would be things such as bathing, dressing, toileting, and then again, like the instrumental activities of daily living include things like shopping, light housekeeping, or preparing meals. And long-term services and supports can be provided in the home as well as in congregate or residential settings. So there's three primary goals of New York Connects, and these are to streamline access to information and assistance about long-term services and supports, to reduce fragmentation within the service delivery through better coordination across systems, and to empower individuals to make informed choices and to support independent living. So really putting a lot of emphasis on the ability for individuals to seek out and become informed on services and supports that will be helpful in their particular living situation. Again, now we talk about silos, and I promise this is the last slide that will represent silos, but it's just that prior to New York Connects, one of the findings in the long-term services and supports system was really the fragmentation that was existing and the difficulty for individuals who have long-term care needs to go out and find the right access point to receiving services. This is due in part because programs vary in their eligibility criteria, their enrollment processes, and the services that are actually provided by program. So New York Connects is a way for individuals to be able to go to one trusted place, one trusted resource in the community, and gain information and assistance and help linking to the services and supports that would benefit them. So we'll go backwards here to provide some history of New York Connects. I've been working with the program since 2007. I missed the opportunity to get in and do the development and design and the implementation by a year. It started in 2006, but when I came into working with the program, I was serving as a long-term care coordinator at the state, and I was able to work with local programs, local county programs, as they developed and implemented and started reaching out to make partnerships in their communities. And Paul had mentioned that New York Connects is about partnerships, and so that's one of the strong suits of the program, and it's key to its success. So New York Connects was established in New York State law in the 2006 Elder Law. At the same time, at the federal level, the national government was creating aging and disability resource centers, which serve a very similar purpose to New York Connects. Typically, states would apply to become an Aging and Disability Resource Center state, and those programs were operated more regionally within the state, whereas New York Connects is, at the time, all state funded, and it was operating in the local counties. So again, here's some more history, and just to mention that in 2008, New York Connects became recognized by the Administration on Aging, which is now called the Administration of Community Living, as an ADRC. And when it was recognized as an ADRC, New York State became eligible for a number of federal grants that would seek to improve long-term services and supports, where New York Connects, which is New York State's ADRC, would serve as a focal point for referral and linkage and the provision of information and assistance within the grants that were obtained. And so to mention a few, we had in 2008 the Nursing Home Diversion and Modernization Grant, which was a really shifting focus to consumer direction, and there was a veterans-directed component actually that came into play. So it was our state's first venture into consumer direction in outside of the Medicaid world, and looking at assisting individuals with flexible funding streams so that they could maintain their independence in their homes and in their communities. And so that grant went on for a couple of years and was joined and expanded actually in 2009 with the Community Living Grant, which just brought that concept into 7 more counties. So those were 2 initiatives that took place, and based on the success of the Nursing Home Diversion and Modernization Grant and the Community Living Program, New York State was actually recognized at the federal level with a Systems Change Grant in 2010. Other grants that New York State was able to acquire due to having New York Connects have been chronic disease self-management programs, caregiver support programs through the lifespan respite, and also a systems integration grant, which was developed to streamline and coordinate services for older adults and individuals with disabilities, as well as to create a dementia-friendly health and human service industry. So those were some key achievements of having a New York Connects program. But arguably the biggest change to New York Connects came in 2010 when New York State was awarded the Balancing Incentive Program through the Patient Protection and Affordable Care Act, which brought a lot of additional federal money to the program so that we can expand and enhance services as it became a central element of the Balancing Incentive Program, which I'll be talking about here in a minute. So the Balancing Incentive Program, or BIP, requirements apply to all Medicaid populations in need of long-term services and supports and involve 4 state agencies: the Department of Health, the New York State Office for the Aging, the Office for People with Developmental Disabilities, and the Office for Mental Health. And BIP reinforces New York State's vision to provide more home and community-based services. And again, as I had mentioned earlier, that it was authorized through the 2010 Patient Protection and Affordable Care Act. So there's 3 core components or structural changes that are required through BIP, and one of them is the one that we're really going to be talking about today, which is the No Wrong Door system. And the other 2 are Core Standardized Assessment Instrument and Conflict-Free Case Management. So the No Wrong Door system vision, which is, was agreed upon by the partnering state agencies that I had just mentioned, the Office for People with Developmental Disabilities, the Department of Health, the New York State Office for the Aging, and the Office of Mental Health, where the agencies would get together and for several years work in a collaborative manner to come up with the vision for what a No Wrong Door system could look like in New York State. And so that experience brought together these state partners, and conversations started off initially with trying to learn each other's culture, each other's language, the types of services that each partnering agency provides, and the structure around getting individuals access into the service delivery system. It moved forward into opportunities where we've been able to train localities through a coordinated effort and to enhance the skills and knowledge base of New York Connect's information and assistance specialists on the various programs that each of the state partnering agencies administers. But the vision for the No Wrong Door system is a visible and integrated system that empowers New Yorkers to make informed decisions about their long-term services and supports needs. So the No Wrong Door, New York Connect serves as the No Wrong Door hub, connecting with partner agencies to better serve individuals across service systems with particular long-term services and supports needs. Basically, the 4 partnering agencies, when they got together, decided to leverage the existing New York Connects program and to build on it, to enhance it and expand it. So under the Balancing Incentive Program, we were able to expand geographically. Prior to BIP, we were in most counties, but we still had 4 or 5 that did not have a New York Connects program, and that included New York City. So when BIP came along, each of those counties developed a New York Connects program. We're not in one county currently, but we're making strides towards bringing in a New York Connects program in that area. Another thing that the Balancing Incentive Program allowed us to do is to expand services functionally. So now we were able to work with the Office for People with Developmental Disabilities to start looking at helping assist individuals with intellectual and developmental disabilities access services in the most streamlined and coordinated fashion, and to really draw upon the expertise of the regional DDROs to help with that. And also, we were able to bring in the independent living centers to the No Wrong Door hub, which is what we're talking about here. And in the hub, and I should mention this, that New York Connects was initially started in 2006 with the Department of Health and the New York State Office for the Aging. Under the Balancing Incentive Program, we were able to develop a request for proposals or request for applications to bring on 6 regional independent living centers that would draw in expertise on serving individuals with disabilities. So we're really rounding out the total expertise of the New York Connects program that serves as the hub of this No Wrong Door system. And so if we take a closer look at the hub, again, I had just mentioned that that it consists of the Area Agency on Aging, local departments of social services, and the independent living centers. And so these are the 3 partners at the county level that are working together to serve as the hub of the No Wrong Door system. And I should mention in this slide, actually, since the ILCs are new, it's been kind of an interesting year. They've been coming on board, getting set up, they've been implementing their programs, but what's really been transpiring behind the scenes is they're developing formal relationships with their local Area Agency on Aging and the Department of Social Services so that they can work in the most coordinated fashion at the county level. So while the state's contracting with 6 independent living center partners, those 6 partners in turn have developed contracts and partnerships with independent living centers in each county. So there's representation throughout the entire state as a part of each of the local New York Connects hubs. So the other partnering agencies we discussed in the past, or a few slides ago, the Office of People with Developmental Disabilities, Office of Mental Health, and Office of Alcoholism and Substance Abuse Service, or OASAS, which is why it's such an honor to be here today. And Paul did mention that that New York Connects hosted regional trainings in the fall of 2016, and we were very fortunate. Paul actually came out and presented at 5 of the 9 regional sessions on asking difficult questions and working with the populations around alcohol and substance use. Office of Mental Health is another partner that's participated in cross-training with us as we've moved forward in furthering the education and enhancing the skills of the local New York Connects information and assistance specialists. And the Office for People with Developmental Disabilities is along those same lines, providing cross-training and expertise in their areas. But there's also going to be a role for the Office for People with Developmental Disabilities and the regional DDROs to perform some of the New York Connects functions, which I can get into in a little bit in the presentation. As we looked at the state partners and we talk about silos and we talk about system fragmentation, we decided to look at each of the partnering agencies' missions. And when we looked at the mission statements, we plugged them into just a basic computer program that populated the most commonly used terms, and they overlay on this map of New York State. And so it's kind of interesting. The ones that really emerged as the most widely used were health, services, communities, people, treatment, and recovery. So it's showing really, I think, that while each partnering agency might have its regulations and distinct subsets of individuals that they're trying to serve, that really there's a lot of commonality and interconnectedness between the state partnering agencies and the agencies at the county level. So this initiative has provided a lot of opportunity for collaborative activities. Some of these are participation in long-term care councils and implementation teams, which I'll talk about in a second, cross-training, which I have mentioned, but I can elaborate on, public education, application assistance, referrals and linking to services, caregiver support, and on-site person-centered planning. And so I mentioned that I would elaborate on the cross-training. Examples including Paul coming out and working with New York Connects at the regional trainings to enhance the skills of the local long-term care information and assistance specialists is a state-level training that's transpired where in 2015, each state partner provided a webinar that we could archive and use throughout the network for training purposes. And so, for example, OASAS did do a presentation in 2015 and introduced the New York Connects network to their practices and to the entrance into services, the types of services that were provided, including inpatient and outpatient, crisis care, and residential care, and also introduced the Hope Line as a valuable resource for the New York Connect specialists to be aware of and to be able to contact when they come across an individual that could benefit from counseling or some of the other services that OASAS is providing. Long-term care councils have a purpose to identify and analyze needs in the long-term care delivery system. They develop strategies to meet community needs, solicit input from key stakeholders, encourage collaboration, and serve as a catalyst to advance change. Long-term care councils are a requirement of the New York Connects program, and really they're the systems change agents that have helped streamline and coordinate services at the back end of New York Connect. So stakeholders from all different departments, professionals, caregivers, individuals with disabilities, there's representation from all segments of the population come together and basically brainstorm the gaps in services in their community, and they can work together to pool resources to address some of those gaps in services. And we've seen a lot of success through the program in areas of housing, social adult daycare, transportation, and so on, in terms of the work that is being done in the long-term care councils. And again, here is the membership that you see. There's a requirement that long-term care councils meet 3 times a year at a minimum. And these are the groups that are required to be a part of the council. And it's not totally, you can have more individuals joining than this, but this is the basic listing of individuals so that we can really get the expertise and knowledge of all the key stakeholders in the community. When the Balancing Incentive Program rolled out, New York Connects, the standards around New York Connects were revised, and so we included the requirement for implementation teams at the local level. And the reason we did this was so that the key planners who are going to be responsible for setting up the framework of the No Wrong Door system in their community would be able to get together and talk about, referral sources, public education activities, marketing, linking to services, the types of services, the amount of resources, eligibility criteria, all those types of things that we talked about from the state level perspective when we did the cross-training and the state agencies presented out to inform the local providers the types of services that were available. Now, the implementation teams at the local level are charged with meeting monthly and working together to flush out how best to coordinate services in their community. The required partners in the implementation teams are the Area Agency on Aging, the local Department of Social Services, the state-selected Independent Living Center or community-based organization representative, and the representative of the DDRO. So key functions of the New York No Wrong Door system, you've got state governments and administration, but then there's public education in coordination with key referral sources, streamlined access to public long-term services and supports programs, and person-centered counseling. To further define the functions, New York Connects provides information and assistance, screening, options or person-centered counseling, and follow-up to ensure connection to services. So this information and assistance in the New York Connects world is a step further really than what you might imagine regular information and assistance to be about. So if somebody calls and asks for, a provider to give home care, that's a basic information and assistance call. What we're talking about here is really going through a screening process. So when somebody contacts New York Connects, they're looking for help. And they basically will lead in typically with, I'm not sure what I need, but I need some help with meals and some housework. Maybe my insurance is off and I have a question about that. So a New York Connects professional is trained to identify the need in an individual to move forward with the screening process. The screening process is standardized in that there's standard elements across every program that are offered through the screening process, but it's also organic and person-centered in that the individuals who are participating in the screening process don't need to answer questions as if they don't want to, and a screen can end at any point in time. So there is consent in this issue where the information and assistance specialist will talk to the individual, ask for their consent to capture and store information, and once they're granted that, they will begin this process. And basically, and we'll get into the screening elements in a little bit, but I just want to bring that up because what we've learned through the New York Connects program is that typically the first thing an individual asks for might not be the end of their needs. And so the screening process really helps to draw out all of the needs that the individual might have. So we're serving people in a very holistic manner. And by bringing in the additional partners under the Balancing Incentive Program, we're recognizing that individuals don't fit into those particular silos that are governed by, one agency's funding streams, that we can do better to coordinate services across the delivery system so that individuals can receive services from multiple partners at the local level so that they're being served holistically. Options counseling, person-centered counseling, this is a process that typically extends beyond information and assistance. It's done one-on-one, and it may take several visits to get to a place where an individual's needs, wants, and desires are really listened to and understood. And so the information and assistance specialist is working with the individual to capture their goals and then to help them develop their plan to move forward and to accept and receive services that will likely get them to a place where they can accomplish those goals. And then following up to ensure connection to services, when New York Connects information and assistance specialists work with individuals, a lot of their work is actually done off the phone or when the person, when their interview with the individual is over, where the New York Connects information and assistance specialist goes and works behind the scenes to coordinate with other health and human service professionals to assist an individual link to services. So there are other functions that are performed through New York Connects: application assistance for public benefits, assistance with care transitions, maintenance of the New York Connects resource directory, facilitation of long-term care councils, and public education. And so it's really incumbent on the New York Connects information and assistance specialist to go out into the community and provide public education. There's been a lot of work over the years with hospital discharge planners so that when individuals are released from the hospital or an institutional setting, they're likely to be successful at home by setting up supports and services that the individual can rely on to keep them safe when they return home. I mentioned the long-term care councils as a key element of the New York Connects program. Maintenance of the New York Connects resource directory, and we're going to get a little bit more into the resource directory in a minute, but basically there's one New York Connects resource directory that includes information on providers throughout the state that are updated by the local New York Connects programs as well as by state partners. So that's something we'll talk more about in a minute. Assistance with care transitions. Again, that's working with discharge planners to assure that when individuals leave institutional settings or hospitals, that supports and services are set up in their homes, and that there's some follow-up there to make sure that individuals are maintaining, their independence and being successful and following their plan to be able to live in their home. And then application assistance for public benefits. This is a really big service that's provided by New York Connects. This assistance can entail helping individuals locate the forms that they're going to need, helping individuals fill them out, copying forms for individuals, and it can go all the way up to the point of helping an individual drop the application in the mail or delivering the application on an individual's behalf. So in the community, people can access New York Connects in person, online, or by phone. And we'll talk about each of these avenues in a second here. So in person, New York Connect services can be accessed in person, either at a local site or by making an arrangement for New York Connect staff to meet individuals in the community or at their home as needed. And so I had mentioned earlier that under the Balancing Incentive Program, New York Connect's program standards were revised. And one of the things that we did was set forth requirements in the standards around in-person visits. Each location where a New York Connects office is housed has to be accessible. And then if in the event that an individual can't get to a local office, New York Connects specialists will go out and meet the individuals in their homes or in their communities in locations that are really accessible to the individual. So there are requirements that an in-person visit has to take place between 1 and 3 days, depending on how the condition of the individual is prioritized.
Where in the community might such an office be housed? I mean, with the county office for the aging, at a DSS office, some people might like to know.
Yeah, that's a great question, and thanks for asking it. So in each program is unique in its own structure, but generally speaking, most New York Connects offices are located in the local office for the aging. In some cases, the local Department of Social Services is the lead on the New York Connects program at the local level, so it could be there. And in other cases, the Office for the Aging might contract out to a community-based organization to administer the program. So there's some nuances there, but in our New York Connects resource directory, which is actually going to be the next slide, there is a tab which will bring individuals that are searching to the local office.
Okay.
So this resource directory is our main catchment for the general public to be able to go on and locate services in their community. This is actually newyorkconnects.newyork.gov, but which is live now, and it's in the process of being upgraded actually. So we're going to have a new look and feel to it that'll be even more user-friendly. But the intent behind the resource directory is to provide a lot of flexibility for a user. So we're building in a self-guided questionnaire for individuals that choose to go on and start to enter in information about themselves and start their own search for services, and an option there to save your search so that you can go back to it in the future and kind of pick up where you left off with things. Another thing is just to do a search for services, or always to contact a local local New York Connects program. So that is a real key element that we've kept in mind, that we want to be able to drive people to these local offices for the aging and the local New York Connects programs so that they can talk to a professional to help them sort out their questions.
I'm glad you mentioned the directory, because I remember being involved in some of the early meetings about it, and seeing it more or less put together. It's the most comprehensive resource directory I think I've ever seen. And I believe the OASAS system is included among the,
Yes, partnering agencies.
okay, so
Websites
it's
are
good that
listed.
people learn about that as well.
Great, thank you. There's a statewide New York Connects number, so each local program has its own number that's advertised, that's advertised locally. And up until recently, most of the marketing and public outreach has been done at the local level. New York State is going to push out a statewide marketing campaign and advertising campaign in the near future. It has so far developed a statewide brochure so that there's some so that the program can be recognized at a statewide level. But the statewide number is designed so that it can route individuals to the local programs. It's automated. When you call this number, 1-800-342-9871, which has all the interpretive services and meets all the accessibility requirements, individuals can state their county that they're trying to get to, and the phone system will automatically route you through. In the event that you're not routed through or the phone system can't understand, your dialect or where you're trying to go, then you're switched over to an individual staff member who will be able to make that connection for you. So each local program has assigned their local number to the 1-800 number, and that's how that routing takes place. I think one of the key features really of the New York Connects program is the screening process. And so you could see on this screen basically that we're seeking the following types of information: basic financial information, current services and conditions, maintaining basic needs, activities for persons needs, activities the person needs help with, current symptoms or situations, communication, relationships, mood and behavior, and person's preferences. So again, the screening process is set up so that it's voluntary. Once you have consent from the individual, then you can engage in this process. And the screening process stops before any level of assessment or formal assessment that you'd be used to. So in other words, the screening is just to capture all the basic needs of the individuals who have contacted the program so that informed referrals and linkages can be made to the appropriate partnering agencies, and then they in turn will do their comprehensive assessments on the individuals. So just to make that very clear, and it really is organic and person-centered in that the individuals can participate in the screen to the level that they're interested in. And also I should note that a caregiver or a professional can call on the behalf of an individual and go through this screening process as well, assuming that consent is in place, so that if the individual who they're calling on behalf of has provided consent, then the screening can take place. The key features of the No Wrong Door screen is that it allows people to receive support in discussing needs and appropriate resources, offers personalized guidance from a trained staff person, can be completed over the telephone or in person, and a family member, caregiver, or health and human service professional can help in providing some or all of the No Wrong Door screen information on an individual's behalf. The No Wrong Door screen, it can help identify whether a person is likely eligible for Medicaid or long-term services and supports, the individual's needs, wants, and preferences, the need for information and assistance, and the need for linkage to appropriate service system for comprehensive assessment. The comprehensive assessment will determine the programmatic eligibility and access to services. So that's something that I had kind of alluded to in the last slide. When the Balancing Incentive Program came about and we started to coordinate, New York Connects was going to serve as the hub of the No Wrong Door system, we recognized that we needed to add additional screening elements into the process. And so we've added the generalized anxiety disorder screen, patient health questionnaire, and the substance abuse screening tool, or the CAGE. And again, this is something that Paul was nice enough to come out and provide training on at our New York Connects regional trainings this fall. And so the CAGE screening questions, have you ever felt that you should cut down on your drinking or drug use, or were told by others? Have people annoyed you by criticizing your drinking or drug use? Have you ever felt bad or guilty about your drinking or drug use? And have you ever had a drink or used drugs first thing in the morning as an eye-opener? And these are the questions that the New York Connects Information and Assistance Specialist would ask that could trigger a referral really to OASAS. And what happens after the screen? Well, New York Connects Specialists will provide information and assistance. They'll discuss options and services available for long-term services and supports regardless of payer source, link to other service systems as appropriate, provide options counseling as appropriate, or provide application assistance. And so these are all services that I had kind of walked through in the past slides, and we can touch base on them here again. Application assistance and follow-up. New York Connects assists individuals applying for public benefits, and some of the examples include Medicaid, HEAP, the low-income subsidy, and the Medicare Savings Plan. And also they follow up to check if individuals have connected to service and referral. So that's a key function really too of the program, is the ability to follow up and make sure that individuals are connected with the supports and services that they were seeking, rather than having the individuals go off and kind of have to fend for themselves. And again, it's been key that New York Connect specialists have been able to sit down with individuals and help them actually complete the applications that will lead to services and supports. And we've had a lot of positive outcomes of individuals receiving subsidies and assistance as a result of this. And also I should mention that at the local level, part of the long-term care councils and the implementation team work that's being done really comes out when you look at application assistance and follow-up, because now the local partner agencies are working together to really coordinate things behind the scenes. So it's known from, for example, by the local Department of Social Services that the New York Connects program will be sending over applications and helping people with their Medicaid and their HEAP and programs of the like. The changes that came about under the Balancing Incentive Program have been big. They've, like I said, expanded the New York Connects program as it serves as the hub of the No Wrong Door system and increased it functionally and geographically, but also at the same time, which has been kind of interesting for the network of area agencies on aging, or the local offices for the aging, is that the state went to one statewide data system, which is great in that we'll have consistent access to data, but it did present, of course, a learning curve for the local programs. What's great about the system is that there's a workflow path built into it that will capture all the New York Connects information and assistance screening elements, so that all local programs will be entering their data in a consistent way. And when I mentioned the independent living centers coming on board to provide the No Wrong Door functions, they're going to be working in a workflow path in our statewide data system. They'll be separate from they'll have their own workflow paths, so they'll follow the same New York Connect screening elements. They won't have access to any of the other networks data, but they'll be working out of the same system, which will be very helpful for referrals and for application tracking and things of that nature. We're looking at doing something similar with the Office for People with Developmental Disabilities and their DDROs as they come on board. And so access to this system is very secure in that it is through the Health Commerce System portal.
Could I just clarify something here, Mike?
Yep.
A DDRO is a Developmental Disability Regional Office?
Yes.
Okay.
Yes.
Thank you.
So what's next? We're going to continue efforts to strengthen partnerships throughout the state. We'll be sharing contact information, working together on the long-term care councils, establish referral agreements, and cross-training. So, you know, we're at this place now with this program that that really started off as a program and has become a system. It's the No Wrong Door system. New York Connects serving as the hub of that. And Paul, basically in your introduction, you summed it up when you said that it's about partnerships. And that's where we've seen all of the success really from this program, in that it's pulling together community partners so that they can, one, solve service gaps in their delivery system, but also to streamline access to those services and to coordinate referrals and linkages among partners. And so we're trying to market and advertise New York Connects as that trusted resource in the community for individuals of all ages, regardless of payer source, to contact when they've got long-term services and supports needs. And I have mentioned our 1-800 number in the past. It's 1-800-342-9871. This is great because it can be accessed nationwide, of course, so individuals and caregivers that might be calling on behalf of loved ones that live in New York can contact that number and can get automatically routed to a local program. And again, our New York Connects resource directory, which is newyorkconnects.ny.gov. And Paul, you had given it a nice plug, so thanks. But that is something that we're still working on, and we're improving and really trying to get the best feel for it so that it can be the most user-friendly tool that individuals and caregivers can have, as well as professionals. We want to see this built into the practices of all discharge planners and other helping professionals, so that they'll have a place to go to pull out information on supports and services for individuals.
I have a couple of questions for you. This has been a fascinating presentation. Actually, I've even learned more than I thought I originally knew, and so it's been very helpful, and hopefully our viewers will feel the same way. But keeping in mind that the typical viewer is likely to be an individual who is working in the substance use treatment system now, and more than likely working as a counselor within that system. I want to go back to the use of the cage, okay? That's a screening device only, right? Okay. And based on the answers to those questions, the New York Connect specialist will then offer to make a referral or even an appointment for an individual, depending on how.
Yes, and like I said, the screen is an organic type of person-centered process. So the cage and the GAD, PHQ, those are all tools within the screen that can
Right.
be used if the New York Connects information and assistant specialist feels like they should be accessing that.
Okay, I just wanted to make I just wanted to make that clear for our audience, because I want them to understand that this is not a diagnosis of any sort. In many ways, this is not this idea is not all that dissimilar from our own expert initiative that we have underway right now. So an individual referred for treatment will arrive needing to be further evaluated.
Right,
Will not have a
correct, yeah.
diagnosis. That's our job. And that person will actually then be connected with our own, with the OASAS No Wrong Door, which is our locator protocol, which ensures proper placement at the correct and appropriate level of care. So I just wanted to make that clear to people.
Yeah, no, I'm glad you brought that up because it's important to realize that these are tools that the information and assistance specialists have in their arsenal, really, to be able to direct individuals to the places that are likely good matches for their needs. So it's really recognizing that because somebody comes in with a need for personal care, and maybe meals, they could have other things going on too that need to be addressed that would really benefit them. So that's where all of these tools are, to really kind of try to pull out all of the key characteristics of an individual so that they can get the services and supports they need. So it's almost just enhancing your network's ability to meet up with people through, the help of others.
Okay. And Project Connects, or New York Connects, excuse me, is designed to serve adults, period. Not necessarily just older ones, but any adult, correct?
Right, yep.
And
And
that starts at what age?
It really starts at all ages. I mean, we kind of carve out the early intervention group, but it's all individuals with disabilities regardless of age and payer source. So, one of the things under the Balancing Incentive Program is to help individuals access Medicaid supports in the most streamlined fashion. But it's also for individuals who have private pay or who rely on other government programs and subsidies.
Okay. So this has been really good because I feel our own system, and I hesitate to use the word system, but that kind of reinforces a difference between aging and OASAS, and again, it sort of resurrects that silo. But this is good for people engaged in the field of substance use treatment and recovery, to learn about this, to know it exists, and to understand it's happening and how it's happening. Because the key word, again, is integration of services. Mm-hmm. And I know there's a tremendous amount of integration going on within the OASAS network, and it's all designed to help people. It's all designed to be person-centered. And I think New York Connects is a wonderful example of that. So I thank you for your time and your efforts in putting together this terrific PowerPoint. And I hope anybody watching this, if you have any questions, please do not hesitate to contact either Mike or myself, or the Learning Thursdays generic mailbox. And I want to thank everybody for watching, and I hope you enjoyed this presentation. Thank you very much.
I would like to thank Paul and Mike for their time and their knowledge today. They came and they offered information that is both new to some of us and relevant to the field. As you can see, your feedback is appreciated. It is a way to gauge if we are meeting the educational and the professional growth goals of individuals in our field. Following taking the corresponding test in the test portal, you will be directed to complete a brief survey at the following link. Again, if you take a moment to do that, it will be appreciated. Thank you again for joining us. Enjoy your day, and we will see you again. Bye now.